Here at Mainline Health, we have an amazing team of genetic counselors who provide service for cancer genetics, cardiovascular genetics, and prenatal genetics. My name is Rachael Brandt, and I am a genetic counselor and the manager of the Genetics and Risk Assessment Program at Mainline Health. Everyone's at risk for developing cancer or developing a cardiovascular disease, so the program is open to all people who are concerned about their health. We will help patients understand what their risks are and what they may be able to do about them. The most important part of the genetic risk assessment process is meeting with a genetic counselor who actually reviews personal and family history risk factors and decides based on that whether you may be a candidate for genetic testing. So we can actually look at your genes and see if there's anything different about your DNA that might suggest that you have a higher risk for developing certain conditions. The cancers we're most concerned about when we look at a family history are breast, ovarian, colorectal, endometrial, pancreatic cancer, and prostate cancer. When it comes to cardiovascular genetic testing, we are looking for individuals who have a higher risk or who have themselves developed a cardiovascular condition. If you decide to do genetic testing, you'll provide a DNA sample, and that gets sent out to a genetic testing laboratory. And the laboratory is looking at the DNA and seeing if any differences are in your DNA that might be significant. And then we report that information to you. And we talk about your risks, your family members, your healthcare management. We put together a plan for you. How are we going to screen you or surveillance? How are we going to prevent this condition from occurring? What treatments may be kind of better tailored to you based on your genetic profile? And then last, we talk about your family members, because you have this gene, there's a possibility it can be passed on to other people in the family. We work together then to figure out who should we consider offering testing to next, how it might be helpful for them. I love evaluating family histories, and I love giving patients information that they can actually use to empower them to make better choices about their health. It can be life-saving, and it makes me feel really happy that I can help them through that journey.